Anti-Vaccine Day, of course.
It's the shot in the arm the United Kingdom and the world needed. The country announcing it will roll out a COVID vaccine within days.
The first phase will include care home residents, health and care staff, the elderly and those who are clinically extremely vulnerable.
With almost 60,000 deaths recorded so far, Britain is desperate to stem the tide of the virus. 800,000 vaccine doses are on the way, but the government has stopped short of making the jabs compulsory.
I strongly urge people to take up the vaccine, but it is no part of our culture or our ambition in this country to make vaccines mandatory.
I think it means life will be able to get back to normal a bit quicker, so yeah, I'm excited for that to be rolled out.
But it's great. We can all go back to life.
We would happily take this if it helped get the message over. I'd take it live on air. I don't care.
This particular vaccine is the one developed by pharma giant Pfizer, shown to be 95% effective. It has to be stored at minus 70 degrees Celsius, just a shade colder than your typical British winter.
The public can be absolutely confident that every rigorous check has been done, that the benefits far outweigh any risk.
Pfizer is one of 5 vaccine developers that Australia has made a deal with. We've agreed to purchase 10 million doses if it proves successful. But with active cases here low, our government wants to hold off until March next year.
In Australia, we're in a very strong position, and that enables us to ensure first and foremost the safety, which enables us to then roll out the vaccine successfully.
So is Australia ripe to wait? And will this vaccine be a breakthrough for Britain?
Rob Grenfell is the CSIRO's Health and Biosecurity Director, and he joins us now. So, Rob, Australia has got about 3 months until we're scheduled to roll our vaccine out. Is there a benefit in us waiting like this?
Well, the choice of the vaccine timing is actually to the TGA's, or that's the Therapeutic Goods Association's discretion, because they're going to actually scrutinise the data. And really, if the UK is releasing this vaccine before us, that's an advantage, because we'll be able to see how it plays, how they logistically can get that vaccine delivered to people, and importantly, to see if there are any unintended consequences of that vaccine as well. It'll give us some great evidence.
Rob, I was reading yesterday that there's areas of the population where this hasn't been tested extensively, so kids, I think, under 12 and also pregnant women. Does that matter?
It certainly does, because in the first stages, after a phase 3, Waleed, we tend to, in fact, release drugs or new drugs or vaccines to what's called a limited release, or almost a phase 4, as we'd call it. And in that, you put it into some of the trial setting populations, or in this case, I know the UK is talking about healthcare workers. And over the period of time, we'll probably find other vaccines which will be more appropriate for children and pregnant women as we get more evidence on this.
Rob, the way this vaccine's going to be transported to keep it cold enough has been described as a sophisticated esky, which makes me concerned for picnics around Australia all summer. But just how fragile is this vaccine?
Look, this vaccine needs to be kept at minus 80 degrees centigrade, and that's seriously more than anything I'd take camping or on a picnic. And minus 80 means that it will really be limited to those facilities that have those fridges, and that's our major teaching hospital. So it will be very difficult to transport this around Australia. So this vaccine is limited in its supply as it stands in Australia.
Rob, is the esky as sophisticated as the esky with the cricket stumps that come out of it?
Well, I agree with you, Pete. That one was actually a great Australian invention, and most of us on the beach have actually certainly applauded the inventor of that one. I do have a fridge I take camping, but it doesn't go to minus 80, and the fish that I catch, when I do catch them, don't usually keep long enough. So, yeah, minus 80 is cold, Pete.
Rob, given how hot Australia gets and how big Australia is, if you're saying that the vaccine can only really be distributed from teaching hospitals, is it the right vaccine for us?
Look, we're going to have a number of vaccines coming through with different abilities with regards to their refrigeration requirements and others. And I'm aware that there's science going into how to deliver these ultra-cold vaccines across many settings. Now, Australia prides itself in being able to deliver vaccines to desert areas. And in fact, we have a test called the Axe Creek test, which really is, can you deliver a vaccine with the right temperature integrity into some of the hottest parts in the world, into Central Australia. And that's what we measure it on.
Well, Rob, roll on 2021. Thanks so much for your time.
My pleasure.
With so much content online, it's sometimes hard to keep up with it all. And let's face it, who has the time? The Project YouTube has you covered with the stories that matter. Hit subscribe for a daily list of the news that you need to know.